Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today we're broadcasting live from HIMSS26 in sunny Las Vegas. Very excited to be here, and it's already been an action-packed 36 hours since I landed. This is actually my 12th year in a row broadcasting live from the HIMSS annual conference, and I am more excited than ever. Love this lineup. I'll get to it here in a moment as well. This is actually my 26th HIMSS annual conference, and I cannot imagine missing any of these at this juncture. Hal Wolf and the entire HIMSS team have been extremely supportive, and I'm so grateful. As most of my listeners know, HIMSS is a very special organization overall. And I want to take a moment, a quick note about this annual conference and the HIMSS Society in general. It can be everything that you want it to be. And I say that from the perspective that you'll absolutely get out of HIMSS what you put into it. This goes for relationships in general in life. But whatever you put in, you'll absolutely get out. And that's what I love about HIMSS and what it affords me. And I actually achieved my annual business goals early in the year because of HIMSS annual conference. This specific forum brings together tens of thousands of industry leaders and affords everyone that truly puts the effort in to achieve their goals. It is an 8-week frenzy for me and my team, but we'll host 3 live radio shows, host 3 large dinner events, co-host 4 receptions, and take in a very fun evening at the Sphere on Thursday. And even at this point in my career, and as you know, Roberta, I'm still hustling. It's a lot of personal work and outreach to bring together 300 plus people over 4 days, but absolutely worth it. And a special note here also, HIMSS is powered by its members and chapters. They are the foundation that drives innovation, connection, and impact across healthcare. I highly encourage you, my listeners, to join your local chapter, get involved, and be part of the community shaping the future of health. And I want to also take a special moment here and note a thanks to my producer, Roberta Mullen, my co-producer, Jake Reed, my other producer, Greg Masters, for their support in helping produce these HIMSS broadcasts and recordings. They are always terrific, and I'm truly appreciative of the time they invest to make this show a success. For this specific broadcast series, though, I have a fantastic lineup of CEOs, CIOs, care providers, innovators, policy leaders, and visionaries. Here's a glimpse. Hal Wolf, President and CEO of HIMSS, Anish Chopra, we all know Anish, Rasu Shrestha from Advocate, Marianne Yeager, CEO of Sequoia Project, Dr. Erica Kim from ARPA, Simon Philip Roast from GE, Nelson Gomes from Medicus IT, Charles Barkey from West Virginia Medicine Hospitals, Richard Atkins, CEO of Greenway Health, Matthew Unangst from AMD, Leah Gabbert from Nutanix, and John Henderson from Rady Children's Health. And I have a couple other special guests joining here that will be broadcasting later. But as many of you know, you've been listening to the show for years. My goal is to create an information medium that shares best practices, strategies, and actionable intelligence from the industry's leading sources and experts. My goal, along with all my guests here, will be to offer tactics and strategies to not only survive, but thrive as you navigate your hospital, your physician practice, your company, or even your family through all these changes occurring across healthcare today. There is more opportunity than ever before for all of us to thrive, but we must understand how healthcare is evolving, how policy and reimbursement is shifting, and where best practice and innovation can support our efforts. I hope you glean all of that over the next few days. That's at least my goal. Welcome back to This Just In Radio Show, broadcasting live from HIMSS26 in sunny Las Vegas. Very excited to introduce my next guest and good friend of the show, Hal Wolf, President and CEO of HIMSS. Welcome back to the show, my good friend.
Thank you so much. It's an honor to be back.
It's great to have you. So first of all, how long have you been in town? How you start prepping?
Saturday morning.
Okay. Excellent. And so tell us about the conference, what's new in the energy here. Lots going on. I've already bragged a lot on a previous broadcast this morning about what's here. So I'm going to talk about that in a second. But first of all, you tell us from your perspective what's new and all the good stuff happening.
Well, first of all, amazingly packed field because finally we're on one campus versus 2 because all the construction's done.
Yes.
So you're feeling the full force of 25,000 people that are just buzzing from one end to the other. I mean, the hallways are jammed, all the booths are really active, and the sessions are going incredibly well.
Absolutely.
I got here Saturday morning, been working since Saturday morning.
Yes.
and all day Sunday, all day Monday, a whole bunch of sessions going on. So it's just a hub of activity.
It is. And so my topic for the previous show that I just did was there are tens of thousands of leaders here, and this is my 26th HIMSS in a row. Not in a row, 26 HIMSS out of 30 years. But this is my 12th year broadcasting the radio show live from HIMSS. Even the off year that we did with COVID, you joined us remotely, a lot of other guests, so that was fantastic. But my point there is, HIMSS is what you make it. This is always wildly successful. I actually make my numbers for the year usually by April or May because of HIMSS annual conference. Whatever your goals are, you can accomplish them because of what HIMSS brings to us as an industry. All the people, the tens of thousands of thought leaders here, the doers that are here, you can absolutely achieve your goals. And if you don't achieve your goals, that's on you. So that's one thing, I would bring up. I love this conference, and it affords me so much opportunity.
Well, Justin, I mean, what you're hitting on is exactly right. It's like almost anything in life, though. You get out of it what you put into it.
Yep.
And having attended HIMSS for many years prior to taking on this position 8 years ago, we would come in with a game plan. What is it we need?
Absolutely.
We would divide up into teams, go out. Each team would have to solve the same problem, and they would come back and say, what did you pick? I think we talked about this once before.
That's right.
That's what makes this spectacular. You have over 1,000 vendors here,
right?
Market suppliers, with every single facet of the ecosystem.
Yep.
So there are answers to find.
Absolutely.
It's just a question of what's the problem you're trying to solve.
Great point. So obviously a lot going on. What's new this year? I know we only have a 12-minute show, and there's lots of new stuff, but what are the main highlights here?
Yeah, I think from my standpoint, it's impossible to talk anything about with a little bit of AI jumped into it. What's different is not AI.
Yeah.
What's different is what we're talking about. So we've gone from it's a concept. Next year, a couple people have deployed it.
Right.
By the way, let's go back to the first year. It's a concept, but we probably shouldn't do anything with it.
There you go. Right.
Next year, a couple people have deployed it.
Yeah.
Third year, 5% of the ecosystem at the highest levels deployed it. This year, it's friggin' everywhere.
That's right.
So what's happened is I think we're seeing the tools maturing.
Yes.
I think we're seeing the results of the activities being documented. So people are fundamentally now documenting outcomes, what's working, what's not. And so the maturity level is improved dramatically.
Yeah, absolutely. We're seeing that with all of our guests and what's being deployed out there. Some pilot sites, but also just large-scale implementations on the clinical side, the financial side, administrative side, with real tangible ROI. These aren't case studies? Yeah.
Yeah, absolutely. Yeah. And the ROIs are being measured appropriately. So let me come back to that. We're trying to accomplish two things. We're trying to bend the cost curve.
Yes.
You're not going to walk in the door and spend $1 million today, deploy AI, and you're spending $800,000 the next. It doesn't work that way.
Yep.
But if you're spending $1 million and you're about ready to spend 1.2, you might come in at 1.1 or 1.15, something, 05. So what we're trying to do is to supplement, to reduce capital cost of building facilities and make up for significant workforce shortages and improve predictive modeling on prevention both at primary and secondary levels.
Yeah, you hit on a great point, and my listeners, heard this earlier from Anish. Even we had Anish Chopra and I had a great conversation on this. Working towards deflationary costs in healthcare. This is really what we expect from AI. It's going to take us as implementers, us as innovators, government programs, care models, all coming together, but creating a real deflationary model because we can't continue to have inflation. But to your point, it will for the short run. But our main goal, success in 5 to 10 years from now, is can we actually create a deflationary curve here through the use of technology?
Yeah, I think that's fair. I mean, I'm focusing a little bit too much probably on the word inflation.
Yeah.
But increased cost versus how much that increase is going to be.
Correct, yes.
As opposed to the pure inflation we're probably going to be getting as a country.
Right.
Because we got a few things going on right now that are going to impact inflation.
Yes.
But fundamentally, absolutely correct.
Yeah, absolutely.
Too technical.
Sorry about that. I love it. What are you most excited about happening in healthcare today?
The sharing and the communication globally. There is no one center like the United States that has any kind of a lock on how the global app ecosystem is contributing. What we're seeing is it's coming from all around the globe. And the reason it's coming around the globe is that before, when you had to go through translation of software, get to a system, proprietary, it was hard to translate. We have tools now that do it very quickly. Yep. The second thing that I'm really excited about is the division between the medical model and the health model. So
that's great. Yes.
I'm and this is gonna be counterintuitive.
Love it.
So bear with me.
Yep.
We always thought that the health model would develop, which is really the consumer-driven device care from home, and it would be absorbed by the medical model, and they would share with each other. Mm-hmm. Hasn't happened.
Right.
Medical model, for all the reasons it always does, a little bit slow, a little defensive, doesn't want to go through change that radically. Meanwhile, because of AI, machine learning, et cetera, the health model's taken off.
Right.
And the consumer element in the health model has accelerated. And so I think it's time for the medical model just to recognize that, play off of it, let the health model run with primary and secondary prevention.
Right.
And let's take those precious resources back into the medical model for higher cases.
Yep. Higher acuity. No, I love that perspective. So kind of building on that, what advice would you give to leaders where they must focus today to best navigate and position their organization for tomorrow? What are some of the best practices there that you'd share?
Readiness, education. Don't go into something you're not prepared for. And be ready to change your business practices to adopt to the new technology, not to adopt the new technology to your current business practice.
Right.
As
you break
always.
things faster.
Right.
Yeah.
NT plus OO equals COO. New technology plus old organization equals costly old organization.
Yes.
This is a time to change scope of practice. This is a time to redesign what you're doing to maximize your return, your output, and take advantage of the tools around you.
I love it. So kind of in that, you made me think back to, I heard you use that analogy late last year. You talked about the growth of HIMSS over the past year or so, and you made greater than that. Can you hit some of those numbers again? That was really, you got up on stage at the Georgia HIMSS annual conference and just crushed it with some phenomenal growth in numbers and opportunity for what HIMSS is experiencing. Can you talk about that for a second?
Yeah, happy to. So I'll go back and just reiterate, 8 years ago, we were a little under 75,000 members globally. Today, we're well over 130.
Yeah.
And it's even much higher than that, but we'd like to keep the number lower because it's just growing constantly. Yep. So we're 130,000 plus. 2 out of 5 HIMSS members are now outside of North America. North America is about 85,000.
Yep.
So we continue to grow in North America. We were very well saturated. Our chapters are growing. Our communities are growing inside North America and communities outside North America, which can be both by discipline and region.
Yep.
And the growth has been absolutely in the Middle East. The growth has been in Europe. The growth has been in Asia Pac. A lot of work at the government level has driven part of this. So whether we're in Taiwan, Korea, Indonesia, Australia, where we're doing government-wide programs of measuring their prowess and development in digital health, or in Europe, where we've done Italy, Germany, Portugal, we believe is next. Romania, we finished this year. Yeah. All of those countries are fundamentally investing and using the recognized international standard of the HIMSS maturity models to measure their growth.
Yeah, I love that, and I'll even make a point, because Seppi emailed me a couple weeks ago, and said, Justin, when you do your live show, let me remind you where you came from and all the chapters that helped you in your time, not only nationally, but you also invested locally. So please make a note of that, and I absolutely will. So the HIMSS, HIMSS, again, what I said earlier and this morning, HIMSS affords you every opportunity that you want to grow your career professionally and personally, and you could get out of it whatever you put into it. But also engage with the local chapters, because that's where a lot of this work is done, and all that local collaboration. So it's great that we come here once a year, but think about that local chapter. Now, those chapters globally, but certainly here in the U.S. is near and dear to my heart. We get some of the Georgia people in the group here in front of us, so we love the Georgia chapter, one of the best chapters of all time. However, a lot of great chapters around the country, but invest locally and get active, because that's where a lot of the change happens. So.
It is. Now, you mentioned Seppi's first name.
Yep.
We're talking about?
Seppi Brown.
That's right.
Yep.
And Seppi has taken on a new role as?
Communications chair. I'm not sure.
No, so at HIMSS, Seppi has taken on the responsibility of coordinating the chapters, the communities. We couldn't be more thrilled. There isn't anyone better qualified we could think of.
Right. Yeah.
Massive enthusiasm, always looking for the angles. And yes, from the Georgia chapter.
Absolutely. No, Seppi's absolutely amazing. I agree. In closing here, what are some of the events coming up? HIMSS, you talked about the international expansion and growth. What's one of the next shows? What are the next couple of shows coming up, either here in the U.S. or globally, that you want to bring up?
Yeah, so, of course, here, very important. Coming up, there's going to be an AI forum in the United States. That's going to be very important. We have chapter leader events coming up. That'll be very important. Globally, we have HIMSS Europe coming up in May. That's going to be in Copenhagen on the 18th and 19th of May.
Excellent.
And that is already, busting at the brim. This is going to be the biggest one ever, which is saying a lot because we grew a lot last year when we were in Paris.
Yep. Yeah, absolutely.
So Denmark is supporting us, and it's really important.
Yeah.
And then we're going to be in Singapore this year for Asia Pac in September. So those are our big events. We'll be redoing Eurasia, of course, in Istanbul. And we continue to work with Informa, who's our partner here,
Absolutely.
With WHX Tech, which is out of Dubai. And so we'll be looking forward to those areas, we hope, calming down. I know there's a lot of activity going on there right now. But, HIMSS is a global entity. We'll move the events around as we need to. But that's part of our growth.
Love it. Congratulations on all the success, Hal. It's great to have you back on air.
Thank you,
You're
Justin.
welcome anytime, and have a great rest of your conference.
Thank you, Justin. Really
Thank you, my
appreciate
friend.
it.
You got it. Thank you so much. Appreciate it.